Hello everyone. Since I received quite a few requests to brief out on the eligibility criteria before taking the COVID vaccine, I thought let me list it out in this video for your understanding. Well, as we all know, the vaccine rollout began in India on 16th Jan 2021 for all the frontline workers. Vaccination of the 50 plus age group and patients with comorbids may also begin early based on vaccine availability. India currently is the third most COVID-19 vaccinated country across the globe. These results are so overwhelming as it reflects on the acceptability of the much needed vaccine. Now, let's get to the topic on who should or should not take the COVID-19 vaccine. The vaccine eligible persons are all persons above the age of 18 years, persons with a past history of COVID-19 infection or an RT-PCR positive illness, patients with history of chronic diseases like diabetes, hypertension, lung disorders, kidney disease or cancers, and persons with immunodeficiencies including HIV. Although it should be remembered that the vaccine response may be blunted in HIV patients as their immunity is already low. Now, let me list down some of the relative and absolute contraindications for the COVID-19 vaccine in India. Persons with known allergies to vaccines, pharmaceutical products, certain food products like nuts, eggs and seafood, and pets. It can only be taken after consulting and at the discretion of your treating doctor. Pregnant and lactating women or women planning pregnancy, persons on blood thinners, anticoagulants, bleeding disorders must take the vaccine only at the discretion of the treating physician. Persons having active symptoms of COVID infection, persons who have received convalescent plasma, acutely unwell or hospitalized persons due to any cause. In the last three conditions, the vaccine may be deferred by at least 4 to 6 weeks after recovering from the illness. Now that I have listed out the eligibility criteria for the COVID vaccines, let me also explain that no vaccine is 100% safe. There are unexpected mild to severe adverse events with taking any vaccine. So to understand about a severe form of allergy called anaphylaxis, let's proceed watching the video. Anaphylaxis is defined as a serious allergic reaction that can begin within minutes to hours of exposure to causal agents like pollens, certain seafood, drugs, animal dust, or even vaccine, and may cause death upon delay of timely treatment. Some of the important clues which requires urgent medical care are rapid progression of symptoms, respiratory distress in the form of wheezing, increased work of breathing, persistent cough or cyanosis, vomiting, abdominal pain, low BP, abnormal rhythm of the heart, chest pain, and finally collapse. But what we need to understand is that anaphylaxis after vaccination is very, very rare. It is reported that only 2 out of every million population can develop this reaction. Hence, since the risk of developing a symptomatic COVID infection is more likely than developing an allergic reaction, let us recognize the potential benefits the vaccine has to offer, which is protection from the COVID-19 infection and formation of a strong and robust immunity. Now, pertaining to the COVID vaccines, some of the most common and treatable adverse events reported and which are similar to other vaccines are injection site pain, headache, fatigue, body aches, fever, joint pains, and vomiting sensation. As doctors, we understand that some of you may be concerned about getting vaccinated in the coming days, but according to the CDC, these vaccines have undergone rigorous safety testing and monitoring for the potential adverse effects. Therefore, if you are an eligible vaccine candidate, do not hesitate to get yourself vaccinated to help build a stronger COVID-free nation. Talking about my experience on receiving the first dose of vaccine on 21st of January, I experienced some bearable pain at the site of injection that appeared after about 6 to 8 hours and lasted for less than a day. And I also felt a little feverish, although my body temperature was normal throughout the day. So the fear of vaccines is largely with the preconceived mindset of developing a reaction or the fear of developing a COVID infection post the vaccination, both of which should be overcome. I hope that this video was helpful. Do like, share and subscribe and hit the bell icon to receive notifications from the White Coat Doctor.